And this is our Weighless RD platform, so turnkey weight loss and wellness programs. I talked about the mission. I will not go over that again. Just to reiterate, the way that we approach weight loss is we factor in all of the imbalances in the body. We are trying to address imbalances in the body as we're creating and as we've created our programs. We're in a dire state, and I just feel like as a profession, like I'm so incredibly motivated to collaborate and do something so we can really drive change. And our strategic weight loss programs, we call them, and I'll talk a little bit about them, like they're so incredibly effective. Okay, so our programs, they do three main things. We literally target the visceral fat. We get the body to use the visceral fat very, very efficiently. We improve insulin sensitivity and we decrease inflammation in the body. Now, I am going into, this is now separate from our GLP discussion we just had. Now I'm talking about those other kits that we call like our strategic weight loss. So again, our goal, we accomplish these three things. After a program, people are literally in an improved state of metabolic health. So again, these are the three different programs. One is called HCA Lean. One is called, we have HCG drops. People are probably familiar with that. And then we have another program called HC2. They're all quick weight loss, but they have slight differences depending on like the needs of the patient. So I'll open it up for questions at the end, but I don't think I really should get into any of the details there. We're always expanding our portfolio. So right now we have the three strategic weight loss programs, and then we have the total gut reset. And then we now have our GLP, GIP support program. And since we talked about that today, I'll just kind of outline some of the things that you would get once you would become that a member with us. So we're going to share all of our nutrition plans with you. We have supplement protocols, our symptom assessment support, all of our patient handouts, and then obviously the app, the whole program is within the app. So what that means is when you set your patient up on it, every single day they're going to receive emails of, tips, support, recipes, meal plans, that type of thing. So our protocols are turnkey. Like I said, everything is done. You'll not only have, like physical handouts to use, but all of the other resources are within the app. So the patient will always have access because this can be 100% virtual as well. So that's another nice thing about all of this. And I'm going to just move this because this is like blocking the screen. Okay, so our app, again, just another look at our app, the 30-day turnkey protocols. The patient, you set the patient up, they get daily emails, all of our videos that we did explaining the diet, booklets, recipes, etc. The other cool thing is it's fully integrated. So they log their food, they log their weigh-ins. You can just practice entirely through this. You message patients. So you don't have to worry about, it's all HIPAA, compliant, and you can put your notes in it. You wouldn't even need like another platform for that. We don't use this as our like EHR, but you technically could. And then we have a number of just maintenance plans too. So maybe they're on the more structured plan for the 30 days. Now they're going off of a plan, and now you're able to kind of customize maybe like an intermittent fasting plan or something like that. So many different cool options within our app. I don't know why this just another look at our app here where they can track all their food and things like that. And you can go in and you can see how they're doing between your visits. And that's always really helpful. You can see their macros when they track, log their food. And then what we have to train dietitians on all of our different programs, we have this RD training platform. So it's about 10 hours of just online going through each of the programs and helping you, understand like how to execute them and things like that. And not only that, we have all of our handouts, and our consents, our protocols and things along those lines. Another look at our training platform. And then just a quick note, because someone did ask me this, and I thought it was a good question. You know, how would you incorporate it into your practice? And of course, that is really going to vary pretty significantly. It is really going to depend, is, you know, some people are sole private practice online, whereas some people are working in an establishment. So you can kind of think, you'll have to kind of think through some of that. But you know, these can be used, they're quick, you know, the strategic weight loss are quick weight loss. So this is not like, they're not on this, they're on it for a period of time. They take a break. Some people like to start, stop, that type of thing. So you can use it first line. We'll use it first line for people that come to us and they're like, I am so done feeling like this. And I want weight loss. I want it to happen fast. So it's those type of people. You can use these as a group program. So we currently are doing a group program where everybody starts on the same day. You kind of lower, you make the price a little bit more competitive. And, you know, you're not doing all the work because you have, right now, I think we have like 60 people doing it at one time. So that's a really awesome way to, you know, obviously support people and then make, you know, scale it a little bit. This can be used for, you know, prior to working on your gut health, or after you worked with someone on their gut health and they still need to lose some weight. You can use these programs as like set times, like you're going to offer it 3 times a year for a reset. We call it our metabolic reset. So people, they look forward to these. They, you know, they're not gaining all their weight back. Maybe they've gained like 5 pounds and now they want to do it. They're just ready for another reset. So that is another great way. And they're all private labeled, proprietary. Nobody will ever be able to go anywhere else to get the kits because it's, again, it's private. So they'll always come back to you. And then of course we have our robust GLP program, which is also fully supported through our app. We have essential supplement support kits that we're finalizing right now. So, you know, we've come to realize that supplements are huge for people on the GLPs, you know, not only while they're on it, but then afterwards. There's so many great things that we can, from a supplement standpoint, we can use to really continue that response that they were getting with the GLPs. So we have obviously symptom assessment, troubleshooting, training, perfecting the right dose, and then, you know, making sure the patient is actually ready for GLPs. I know, you know, ours is a little bit different because we're starting people on it, but you may see a patient where you're like, you know what, maybe they need to take a break on their medication and do like some type of reset first to get the body more ready for the medication. All right, so this is the pricing for the kits. So this is going to help you kind of conceptualize like profit margin. All right, so you would buy a kit from us. Let's say you wanted to start out with HC2. I know you don't really know the specifics, but I'm giving you, you know, an idea of what it looks like. So you buy the kit for $90 from me. And then we charge $4.99 for this program, for this 30-day program. So your pricing may look different. This program price does include weekly visits. So we are scheduling like a 20-minute call with them, or they're coming in, you know, we're checking in, we're making sure they're following the diet, weight loss is good. So some patients will get to a point where they're like, I don't need to see you every week. I just want to do it online. So then we charge $375 for that. So we don't do anything. We literally put them on the app. They get all the support through the app, and then they do it on their own. So your profit margin ranges from $285 to $409. The only thing that's not considered in here is like your time that you're seeing someone, and it's usually like a 20-minute visit. So the HCG drops are $17. This is what we charge, the same amount. This is obviously that 4 is supposed to be a dollar sign. And then the same with the okay. So this is HCG drops, and then HC lean is over here. And then the same thing, $90 you pay. You can buy as many as you want. If you want to start out with 5 kits, we ship you 5 kits, totally up to you. so I'll go over what it costs to be like the member, but just know that all you would have to do is sell like 10 programs, and that would basically pay for your membership. So these strategic weight loss, this is the results we get. 12 to 25 pounds of weight loss in the 30 days. And again, I know there's going to be people on here that are like, that's so unhealthy. We know exactly what they're losing. We know that if we're going after the visceral fat, we know it's a healthy weight loss. Decreased inflammation, we measure their inflammation. We know that the blood sugar balance and insulin sensitivity is improving. And at the end, they have improved metabolic health. They are in a different state of health, 100%. They may not be at their optimal metabolic health, but people are constantly just shocked at like, oh, I went on vacation. I can't even believe that I didn't gain weight. I always gain weight when I do. And it's like, we have to keep reminding them that you are in a different state of health right now. So, that's kind of what people can expect. And then, so again, just to reiterate, and then I'll give the price. If you decide to move forward with this, you get to use all of our protocols, all of our resources. We're doing monthly mentorship calls. You get access, you have your own Weighless RD, Weighless RD app with everything's already in there, done for you. And then the whole goal, which I hope that other people feel the same way, is that we want to move this. Like we want really to drive change. Dietitians and nutritionists are literally, we need to be the pioneers in helping change all of this crazy chronic disease, obesity. I mean, it's crazy where the numbers are going. So our regular pricing is $3,900. That's a one-time fee. And then there is a $49 a month ongoing support and mentorship fee. And then you do pay for the app. It's $99 per month, and that's paid to the technology company. So if you don't like the app, whatever, monthly, some people just will put that price on to the patient, but usually you make enough on the program that that price doesn't really matter. Okay, so this is our regular. Now we do offer you can kind of break up the payments. So what you can do is you could pay $1,000 up front, and then for 12 months you pay $300 per month, and that's going to cover the remaining one time and the full year of the $49 per month. So then you'd pay the $300 per month for 12 months, and then you would pay the $99 month to the app company. But we are running a promo. So October, we're running a promo. We're calling it our founding member promo, because we want to collaborate with the best dietitians and functional nutritionists out there. We're super excited about that. So the first 10 people are going to get $1,000 off, and basically you would pay $2,900, and then the ongoing would be the $49 a month, and then the app fee. So hopefully that made sense. I'm just gonna. Are there any questions